with COVID-19 cases surging again across New Mexico, health officials have been warning about hospital capacity reaching a dangerous point. So how much room do hospitals actually have in your community? Here's News 13's Gabrielle Burkhart.
The state is tracking data from each of its hub hospitals across New Mexico. Since some rural communities have fewer beds, more patients could be moved around. The warnings are widespread. COVID risk is extreme. Protect New Mexico hospitals and stay home.
Typically, hospitals are about 60 to 65% full, although that varies throughout the state and of course when you're not in the middle of a pandemic.
Right now, statewide, 81% of adult general beds are occupied and 71% of ICU beds are occupied. But hospitals have made it clear it's not all due to COVID-19.
There's never been a point in time when COVID patients were the majority of hospitalized patients, and our goal here is to try to balance capacity.
Human Services Secretary Dr. David Scray says there's a high burden of disease in New Mexico for things like heart problems, stroke, and diabetes. And because we're in a healthcare crisis, hospital capacity is a top priority. For 33 counties, New Mexico has 7 major hub hospitals it's tracking. This map gives an idea of where patients from rural communities can be transferred. San Juan Regional Medical Center in Farmington has the fewest number of ICU beds with 14. They currently have 5 COVID patients and 1 in the ICU. Eastern New Mexico Medical Center in Roswell has 4 COVID patients in the ICU and 19 ICU beds. Las Cruces hospitals have 67 COVID patients hospitalized and 46 ICU beds still available. Presbyterian reports 70 COVID hospitalizations, 20 of which are in the ICU. But each facility says it still has room, with contingency plans in place to take on more patients. Now, the main hub is, of course, Albuquerque, with the state's only level 1 trauma center. A doctor from UNMH today attributed the current hospital surge to people who've delayed regular medical care over the past 7 months. Back to you.
Okay, thanks, Gabby. Now, according to the state, New Mexico hospitals have a baseline capacity of 290 ICU beds. With contingency plans for what the state calls crisis standards, we have an absolute maximum capacity of 623 ICU beds.